So in 1985, the first blood test was introduced to detect AIDS, and so this was a big deal because people were now able to see if they had AIDS or if they had AIDS. So although the disease had its name, the prejudice against gay people and other people that were affected with HIV/AIDS increased. So the hemophiliacs were seen as the innocent victims who had AIDS, and the gay men were accused of bringing this disease upon themselves. And so, for example, some people were fired from their jobs in fear that they were going to transmit this disease to them or to their coworkers. And so this was a big controversy, and this is an example. This poster is an example of kind of a message that they were trying to send, that AIDS can affect everyone, not just gay people or not just black people. And so this was one of the biggest controversies that was happening at this time. So on October 3rd, 1985, the first famous public figure, actor Rock Hudson, died from AIDS. And this was kind of a big deal because a lot of people knew family members or friends that have died from AIDS, but no one really knew someone that everyone would have known. So when this first actor died, it kind of made people, rethink a little bit how they were judging people that had AIDS and stuff like that, because this famous actor that everyone loved died from AIDS. So in May of 1986, the International Committee on the Taxonomy of Viruses stated that the name of this virus was HIV/AIDS. And so they already had the name AIDS, but before you can develop AIDS, so AIDS is a progression. So HIV is a progression of AIDS, and AIDS is a progression of HIV. And so HIV stood for human immunodeficiency virus, and then it progresses into AIDS, what stands for acquired immune deficiency syndrome. So there aren't an official list of symptoms for HIV/AIDS, but they are now some official reportings of similar symptoms that most people would get. And so after 2 to 4 weeks of first exposure to someone who's infected with HIV, some people, not everyone, may experience flu-like symptoms like fever, swollen glands, sore throat, rash, fatigue, and muscle and joint pain. But like I said, this isn't for everyone. Some people don't have any symptoms, and then they move into a stage called clinical latency stage. And this stage can last up to 10 years or more. And it's a stage where the virus is developing inside of its host, although it's not producing any symptoms. Now you can see where this becomes a problem, because if it's not producing any symptoms, and this person will live their normal life and transmit HIV/AIDS to other people, and now those people wouldn't know, and neither would the person that had it know. And so after like 10 or 15 years, and the person who has HIV moves out of this clinical latency stage, and they move into AIDS. And so some symptoms of AIDS are rapid weight loss, extreme tiredness, prolonged sweating of glands, diarrhea lasting more than a week, sores, pneumonia, memory loss, and rashes. So the CDC came out with a treatment and prevention for HIV/AIDS. And so the treatment is an antiretroviral drug. And so I'm going to show a quick video that describes what an antiretroviral drug is and what it does.
The World Health Organization has made key recommendations regarding antiretroviral therapy. Any HIV patient with a CD4 count of less than 350 cells should begin antiretroviral therapy. It is important to clarify that antiretroviral therapy is not a cure. Additionally, adhering to an ART treatment regimen on a consistent basis is difficult for many people to manage. The medications have multiple side effects. Additionally, between the ART medications and other medications used to treat opportunistic infections, an HIV-infected person might be taking as many as 40 pills each day. Some of these medications must be taken with meals. Some medications must be taken on an empty stomach, while others must be taken 2 hours after a meal. The scheduling alone can make it difficult for some people to adhere to the treatment regimen. A major concern with ART is the potential for developing drug resistance. Newer antiretroviral medications do offer some improvement against drug-resistant HIV.
Okay, so the CDC also came out with some prevention options for HIV/AIDS. So some prevention methods are safer sex, and so for safer sex, you need to use condoms, and that will definitely prevent against HIV/AIDS. And for some people that are at a really high risk of getting HIV, they can take something called pre-exposure prophylaxis. And so pre-exposure prophylaxis is a prevention option for people who are at high risk of getting HIV/AIDS, and it's an everyday pill. And so it doesn't necessarily prevent against it, and it doesn't mean that you can stop practicing safe sex, but it just means it's something that you can add on to all these other prevention methods, and it's something that'll might slow down the way that HIV is spreading in your body if you already have it, and it'll slow down the transmission rate. And so as of right now, there isn't a vaccine for HIV/AIDS. And so a vaccine is something that it's a shot that helps provide immunity by imitating an infection and causing the immune system to produce T cells and antibodies that'll fight off an infection. So why wouldn't a vaccine for HIV/AIDS be a good idea? So when we think about a vaccine, we think that it's really good and it'll help prevent whatever it's trying to prevent, whether that's yellow fever or something like that. But a vaccine for HIV/AIDS isn't good because, connecting back to the video that we just watched, it talked a little bit about how HIV/AIDS could potentially mutate or become resistant to the antiretroviral drugs, and it could also become resistant to the vaccine. And so basically what could happen is, if you have this vaccine inside of your body, it could try to imitate HIV/AIDS so it can then cure it, but it could possibly become resistant and even cause HIV/AIDS in your body because of this vaccine. So that's also another looking at it from a different perspective, why maybe a vaccine wouldn't be such a good idea. So after I did all my scientific research, I had to mathematically model the spread of HIV/AIDS in Los Angeles, California in 1981, and I modeled the case of the 5 previously healthy gay men. And so the way that I did this is I used a mathematical modeling simulator. And so this is what the default setting looks like. Oh, sorry. This is what the left picture is what the default setting looks like on the simulator. In the right is the parameters that you need to adjust to model out your own disease. So what I did was I first adjusted the parameters to best model out the spread of HIV/AIDS in 1981 in Los Angeles. So I first changed the grid dimension to a higher dimension to represent Los Angeles itself. I changed the initial population to a really high population to show the amount of people in Los Angeles. I changed the number infected to 5, which represented the 5 previously healthy gay men. I switched the number immune to 0 because nobody can be immune to HIV/AIDS. And I switched the days the illness lasts to 9. I switched this because the illness will last a lifetime, and so in the simulator, the max number of days this illness class was 9, so I switched it to 9. The days before infectiousness, I switched to 8, which represents the clinical latency stage. And then the probability of death, I switched to 0.85 because someone who's left untreated with HIV/AIDS has a probability of death that's around 80 to 90%. And the rest of the parameters stayed at its default setting. So after I adjusted the parameters, I implemented them into the simulator, and so this is what it looks like after all the parameters are adjusted. So you can see how the 5 red dots represent the infected men, and then the green dots represent the normal people of Los Angeles, and you can see how the parameter is kind of big. And so I then ran that trial 12 times, and this is the data that I got for it. And so the data told me how long the epidemic lasted, which it lasted 40 days. It told me what the death count was, which was how many people died. And so I had um, I started the parameter at around 500 people, and 489 people died. And so basically everyone died. And then I have a number who never got ill, and that's 0 because everyone got ill. And then I have a number who got ill and then recovered. And so this average number is around 72 people that got ill and recovered. The picture kind of cut that number off. And so this result is kind of important to remember, and I'll address that later in my presentation. And so after I ran this first trial, I needed to make a recommendation to lower the probability of death. And so I first had to make a claim. And so we all had to make a we first all had to make a recommendation to lower some sort of parameter or lower the spread or contain the spread. And so I made recommendations to lower the probability of death. And so I made a claim for my data. My claim was, through my recommendations, the probability of death will be lowered and the life expectancy of someone who is infected with HIV/AIDS increases. So why should I lower the probability of death? So to connect this to the real world, antiretroviral drugs do that exact thing. So they don't cure someone that has HIV/AIDS, but they lower the probability of death and increase their life expectancy. And so I wanted to model this out in my scenario, and connecting back to the real world, the way that people would get this antiretroviral drug is having more HIV and AIDS testing. And so going back to my simulator, I lowered the probability of death by going back to my parameter and adjusting the probability of death from 8.5 to 0.5. And I didn't specifically choose 5, I just chose a couple notches down to see if it would model out what I wanted it to show. So after I reset my parameter, I reset my trials, and I did 12 runs of the spreading of HIV with the lowered parameter, and I got that the epidemic lasted a little bit longer, which was an average of 76. The death count was an average of 473, and this was expected because I wasn't expecting people to fully recover. I was just expecting them to have a longer life. So this was fine. And then the number who never got ill was still 0 because everyone still got ill. And then the number who got ill and recovered increased to 251. And before it was 72. And this kind of proves that my recommendation worked, because if I lowered their probability of death, then the number who got ill and then recovered increased. And so to conclude my data, if the probability of death is lowered, the life expectancy of someone who is infected with HIV/AIDS increases, and I can support this in my data and my research.